Hey there, lovely listeners. Welcome back to our podcast. I'm Hari, and as always, I'm here with the fabulous Leela.
Hello, everyone. So excited to dive into today's episode with you, Hari.
Absolutely. Today, we've got a jam packed show for you all. We'll be delving into a variety of thought provoking articles that touch on some crucial topics.
That's right, Hari. We'll be exploring equitable TB care, comprehensive TB care, the intriguing world of tattoos, and the complexities of Kurdistan's quest for statehood.
It's quite the lineup, isn't it? I can't wait to unpack these articles with you, Leela. Each one offers a unique perspective and plenty of food for thought.
Definitely, Hari. And for our listeners, get ready for a longer episode today. We're going to be spending some quality time on each topic, really digging deep into the issues at hand.
So grab your favorite beverage, get cozy, and join us as we navigate through these diverse and fascinating articles. It's going to be an insightful and engaging ride, so let's jump right in. Article 1. So Leela, let's dive into this fascinating article about equitable TB care and its crucial role in achieving universal health coverage in India. TB has been a significant public health issue in the country for a long time.
Absolutely, Hari. Did you know that India has the highest number of TB cases globally? It's a staggering statistic that highlights the urgent need for effective and equitable TB care strategies.
That's a concerning fact, Leela. The article mentions how India has been making progress in TB care by implementing strategies like molecular testing and involving communities in the process. It's heartening to see a decline in TB incidents and related deaths due to these efforts.
Definitely, Hari. The shift towards integrating TB services into universal health coverage, especially through initiatives like the Ayushman Bharat scheme, is a step in the right direction. By ensuring high quality and accessible care, we can make a real difference in combating TB.
It's great to see the focus on person-centered care and the recognition of intersectionalities in healthcare. By integrating general health screening and minimizing out-of-pocket expenditures, we can truly enhance equitable TB care for all.
Absolutely, Hari. Access to information and knowledge plays a crucial role in combating TB stigma and encouraging care-seeking behavior. It's vital for the public to have a clear understanding of TB to reduce transmission and improve overall health outcomes.
Moving on to the current relevance of this topic, Leela, we can see how these strategies are more important now than ever, especially in the context of the ongoing pandemic. The lessons learned from TB care can inform our approach to other infectious diseases as well.
That's a great point, Hari. The principles of person-centered care and community involvement can be applied in various healthcare settings to improve overall health outcomes. By addressing challenges like strengthening referrals and ensuring insurance coverage, we can build a more resilient healthcare system.
Absolutely, Leela. However, it's essential to acknowledge the challenges and controversies surrounding equitable TB care, such as out-of-pocket expenditures and disparities in access to care. Finding sustainable solutions and ensuring that no one is left behind will be key in overcoming these obstacles.
Definitely, Hari. By focusing on innovation and collaboration, we can pave the way for a brighter future in healthcare. The integration of TB services into universal health coverage sets a positive precedent for addressing other health disparities as well.
It's exciting to see the potential developments and innovations that lie ahead in the field of TB care. By staying committed to equity and inclusivity, we can truly make a difference in the lives of many. Let's hope for a future where everyone has access to high-quality healthcare.
Absolutely, Hari. The journey towards achieving universal health coverage is ongoing, but with dedication and collaboration, we can create a healthier and more equitable world for all.
Article 2. So Leela, the article we just discussed really sheds light on the importance of a comprehensive approach to TB care. It's fascinating how Dr. Ramya Ananthakrishnan emphasized the need for efficient systems to support patients like Rani.
Absolutely, Hari. It's crucial to have a seamless response for TB patients to ensure they receive the care they need. Did you know that TB remains one of the top 10 causes of death worldwide, even though it's preventable and curable?
That's a staggering statistic, Leela. And Dr. Ananthakrishnan's points about the essential components of comprehensive TB care, like a resilient public health system and trained health workers, really drive home the need for a multifaceted approach.
Definitely, Hari. It's not just about diagnosis and treatment. It's also about addressing social support, stigma, and overall care quality. The involvement of various stakeholders, from champions to corporate engagement, is crucial for a holistic response to TB.
Moving on to the current relevance and applications of this topic, Leela, how do you see these principles playing out in today's world?
Well, Hari, with the ongoing COVID-19 pandemic, the importance of a robust public health system and trained healthcare workers has been magnified. We've seen how community empowerment and multi-sectoral action are vital in responding to health crises effectively.
Absolutely, Leela. The principles discussed in the article are not just relevant for TB care, but can be applied to various public health challenges we face today. For example, integrating TB care into insurance schemes could ensure more people have access to treatment.
And let's not forget the challenges and controversies that come with implementing such a comprehensive TB care approach, Hari. There might be debates around funding, resource allocation, and even the prioritization of TB care among other health issues.
You're right, Leela. Balancing competing priorities and ensuring sustainable business models for TB care can be complex. However, finding innovative solutions, involving all stakeholders, and leveraging media attention can help address these challenges effectively.
Looking to the future, Hari, how do you think the landscape of TB care might evolve? Do you see any potential innovations on the horizon that could transform the way we approach TB?
Well, Leela, with advancements in technology and increasing awareness, I believe we might see more personalized and targeted approaches to TB care. Innovations like telemedicine and AI could revolutionize how we diagnose and treat TB, ultimately improving outcomes for patients.
That's an exciting prospect, Hari. As we move forward, it's essential for us to continue prioritizing comprehensive TB care and working towards a world where suffering and deaths from TB are significantly reduced.
Article 3. So, Leela, this study on tattoos from Denmark is quite intriguing. It suggests that our decision to get tattoos is more influenced by nurture rather than nature. What are your initial thoughts on this?
Absolutely, Hari. It's fascinating to see that even though identical twins share all genes, the study found that there was no significant difference in tattoo choices between identical and non-identical twins. This really highlights the impact of our environment and upbringing on such personal choices.
It really does. The fact that the study showed an increase in tattoo popularity over time, especially among the younger cohort, indicates a shifting cultural trend towards more acceptance of tattoos. It's intriguing how societal norms and values play a huge role in our decisions.
Definitely, Hari. And the comparison with birth defects in twins was also quite interesting. The study revealed that certain birth defects were more influenced by genes in identical twins than in non-identical twins, showing a clear distinction between genetic factors in different aspects of our lives.
Moving on to the current relevance of this study, Leela, it's clear that tattoos have become increasingly mainstream and widely accepted in society today. We see people from all walks of life, including professionals, artists, and even athletes, proudly displaying their tattoos. It's become a form of self-expression and art for many.
Absolutely, Hari. Tattoos have transcended their previous associations with rebellion and counterculture to become a means of storytelling and celebrating one's identity. In fact, many workplaces have relaxed their policies on visible tattoos, recognizing the changing attitudes towards body art.
And let's not forget the role of social media in all of this. Platforms like Instagram are filled with tattoo artists showcasing their work, influencing trends and styles. It's like a whole new form of artistry and self-promotion that has been amplified by the digital age.
Shifting gears to the challenges and controversies surrounding tattoos, Hari, there are still debates about the long-term implications of having visible tattoos, especially in professional settings. Some argue that tattoos can still carry stigma and affect job opportunities, while others champion the freedom of self-expression.
That's true, Leela. It's a fine balance between individual expression and societal norms. Finding ways to navigate these challenges, perhaps through education and awareness, could help bridge the gap between personal choice and societal expectations when it comes to body art.
Looking ahead, Hari, I wonder how tattoos will continue to evolve in the future. With advancements in tattoo technology, like UV tattoos and biometric tattoos, we might see even more innovative ways for people to express themselves. It's exciting to think about the intersection of art, technology, and culture in the world of tattoos.
Absolutely, Leela. The future of tattoos seems to be heading towards a more personalized and technologically integrated direction. It will be interesting to see how these developments shape not only individual expressions, but also societal perceptions of tattoos. Exciting times ahead for the world of body art. Article 4. So, Leela, the complexities of Kurdistan's quest for statehood are truly fascinating and multifaceted. The historical background of the Kurdish people and their struggle for self-determination is quite intricate.
Absolutely, Hari. The Kurds have a long history of resilience and a desire for autonomy that spans across regions like Turkey, Iraq, Iran, and Syria. Did you know that the Treaty of Sèvres in 1920 actually included provisions for a Kurdish state? But unfortunately, it was never fully realized due to various internal and external challenges.
That's a crucial point, Leela. The internal divisions among the Kurdish population have indeed been a significant obstacle in their pursuit of statehood, and the emergence of groups like the PKK, with their armed struggle and leftist ideology, brought a new dynamic to the Kurdish resistance movement.
The PKK's role in the Kurdish struggle cannot be understated. Their guerrilla tactics and ideological stance have garnered both support and condemnation on the international stage. It's interesting to see how external factors, such as differing views on the PKK's classification as a terrorist group, have influenced the Kurdish cause.
Absolutely, Leela. The international community's response to Kurdish autonomy in various regions has been quite varied, with different countries taking different stances based on their geopolitical interests. Recent events like the failed independence referendum in Iraqi Kurdistan and the establishment of the Rojava region by Syrian Kurds highlight the ongoing challenges and shifting dynamics in the quest for Kurdish self-governance.
It's clear that the Kurdish people continue to face numerous challenges and controversies in their journey towards statehood. The debates surrounding Kurdish autonomy, the PKK's tactics, and the response of surrounding nations all contribute to the complexities of the situation.
Finding a resolution to these challenges is no easy task. It requires a delicate balance of addressing the legitimate aspirations of the Kurdish people while also considering the concerns of neighboring countries. Perhaps a nuanced approach that takes into account the various perspectives involved could pave the way for progress in the Kurdish quest for statehood.
Absolutely, Hari. It's crucial to acknowledge the diverse viewpoints and interests at play in this complex issue. Only through open dialogue, mutual respect, and a shared commitment to peace and stability can the Kurdish people move closer to achieving their long-standing goal of statehood.
Looking ahead, the future of Kurdistan's quest for statehood remains uncertain, but one thing is clear. The determination and resilience of the Kurdish people in the face of adversity is unwavering. As developments continue to unfold, it will be interesting to see how the international community responds and how the Kurdish struggle evolves in the years to come.
Definitely, Hari. The Kurdish people have shown incredible perseverance throughout history, and their journey towards self-determination will undoubtedly continue to shape the geopolitical landscape of the region. It's a story that we'll be watching closely as it unfolds.
Conclusion. As we wrap up today's discussion, Leela, I can't help but feel inspired by the strides being made towards equitable TB care and universal health coverage. It's really heartening to see the focus on providing comprehensive care for patients.
Absolutely, Hari. And let's not forget the fascinating insights we gained from the article on tattoos, highlighting how nurture plays a significant role in shaping our choices. It's a reminder that our experiences and environment can deeply influence our decisions.
And diving into the complexities of Kurdistan's quest for statehood shed light on the challenges faced by nations striving for self-determination. It's a potent reminder of the resilience and determination of people fighting for their rights.
To our listeners, we encourage you to reflect on these diverse topics we've explored today. How can we contribute to more equitable healthcare systems? How do our surroundings shape our preferences and identities? And what can we learn from the struggles of regions seeking autonomy?
Thank you for joining us on this enlightening journey. Remember, your thoughts and actions matter in shaping a more inclusive and understanding world.
Stay curious, stay engaged, and most importantly, stay compassionate. We appreciate you tuning in, and we look forward to exploring more thought-provoking topics with you in our future episodes. Until next time, take care and keep seeking knowledge.